Hello, everyone. Welcome to today's webinar. My name is Khalil Doheny. I'm the Senior Content Marketing Manager at Digital Niche Agency. Today, I have Dr. Tej Singh. Doctor, how are you doing today?
Good, Khalil. Nice to be here. I hope you have a great audience for a great session, I think.
Yeah, I'm excited to get this webinar going. Whoever's attending today, let us know where you're tuning in from. I am coming in from Los Angeles, California. It's beautiful and sunny. There's a slight breeze, which it's rare in this type of month, so it's great to see. Doctor, where are you tuning in from?
So we're up in Northern California in Silicon Valley, so just about a 6-hour drive up north from you, and the weather always here is perfect. So we're excited about that.
That's awesome. Doctor, do you want to kind of just give a quick intro to yourself before we get started here today?
Yes. So thanks, Khalil. Thanks, everybody who's joining. I think this is a really unique opportunity. I am a vascular surgeon. I've trained at Stanford University. I do and still have a very active, busy vascular surgery practice. So I'm dealing with all types of vascular ailments. This talk is probably one of the most unique talks I've ever given in my life. And it's basically because of patients asking me to do this talk about arm circulation. In my 30 years in vascular surgery, and I've been all over the world talking, teaching, doing vascular surgery, I've never seen a talk that has the power of arm circulation as the theme. And I hope this will help our patients, our various people who are interested in research all across the world who are tuning in. We're going to focus today on something which has been neglected by medicine for the last 50 years that I can remember, and that is a focused talk on arm circulation. So I think this will be a special event.
It's awesome. It's awesome. And, with that being said, let's just dive straight into it. If you want to share your screen, and I know you put a presentation together for us today.
Okay, does that show up okay?
Yep, perfect.
All right. Okay, Khalil, I'll take over. And thanks, everybody. Once again, Dr. Singh, I'm a vascular surgeon. I practice here in Silicon Valley at El Camino Hospital. Today, we're going to be spending the next 35 minutes talking about arm circulation. I'm going to try to go at a pace because I think there's a lot of people who are on this webinar who have asked me to talk about conditions about their arms. So please be respectful that everyone's questions, we will try to answer them all, but there may be questions that you can send to us at the end that I will try to address. I'll also give information if you have any questions that you want to directly relate to me, either on social media or on my emails. I am a busy vascular surgeon. This talk is all about arm circulation. A little bit about me. I did a lot of my education, initial education in Chicago at the University of Chicago. A lot of what I'm going to be talking about is in my vascular surgery years when I was at Stanford, and I've done some more work in the business aspect of healthcare at Auburn and at Stanford. I will be focusing a lot on my career knowledge as a vascular surgeon. I do have a conflict that I do have a research device and a company that is trying to address some of these needs. We will not be talking about any commercial devices today or any business, so there will be no conflict about that. As Khalil said, I am from Northern California. Please do understand that I am giving you an education on a webinar. I am not your physician. You will speak to whatever you learn today to your physician. I hope it gives you a chest of opportunities that you and your physician can talk about. But I want to make sure you all realize that your physician, your healthcare team is your priority for excellent healthcare. I hopefully will give you some questions, tools, things that you can use to help your care. If I do that, then I feel good that I've met my mission of this talk today. Insanity. If we keep doing the same thing over and over again, and we expect things to be different, that's insanity. Albert Einstein said that, and we have learned over 50 years that nobody seems to care about arm circulation. I'm a vascular surgeon. I speak all over the world. Do you think anybody's ever given a lecture on arm circulation? I think today's webinar is the first lecture focused on arm circulation in the history of modern vascular surgery. That's a very strong statement, but I do think it's true. We will talk a little bit about blood pressure. We'll talk a little bit about arm veins. We'll talk about healthy arm veins. We'll talk about arteries. We'll talk a lot about science. At the end of this, we'll talk about your own healthcare needs. Maybe you have someone in your family with a healthcare issue, but I will say the river of life to quality healthcare goes through your arm circulation. I want to say that again. The river of life goes through your arm circulation. How do you help your arm circulation? A lot of my research started in this back in the 1980s when I was at the University of Chicago. We were trying to understand blood flow, how blood flow changed in the body, what did blood flow do to the body? And that was my initial take on this whole topic. When I then went to Stanford University, we talked further about blood flow in the arms. We talked about different ways to make blood flow changes in the artery and the vein, what that did to the arm, what that did to the vein, what that did to the muscles in the arm, in the body. So a lot of that research has gone on at two very powerful universities. And I was very privileged to have great mentors at those places to teach me about circulation. What is arm circulation? In a nuts and bolts, when you go to your doctor's office, the arm for us in circulation is blood vessels who move the blood, the arteries that bring the blood to the muscles, veins that bring it back, and those veins can be either deep or superficial. These 5 terms focus on arm circulation. The heart is what does the pumping to the arm, but the blood vessels, the arteries, and the veins, those are the key to arm circulation. And I've already shown this picture on the right. These are the veins of the arm. And you don't need to really know them all, but many of you are using these veins directly or indirectly in your daily medical care, whether they're deep veins, which are deep in the muscles, or whether they're on your skin. And they could be superficial. They could be the cephalic vein, which is the most dominant vein on our arm that is used for blood draws, used for dialysis. The cephalic vein is right underneath your skin. And that vein is the vein that branches, and many things happen with the cephalic vein. But blood arteries, and the whole blood vessel network is really important for arm circulation. And we, of course, have these veins. We have the subclavian vein, which is up by your shoulder, above your collarbone. We have the cephalic vein that we've talked about. We have the basilic vein. We have other veins that are really important to carry our circulation. So what is really happening? And what is the reason why arm circulation is really important? And this slide here is the science of over 20 years of my life. What we learned is that if you take a normal vein and you give it changes in blood flow, changes in pressure, changes with massage, all those changes, the wall shear stress, the wall tensile stress, and nitric oxide, the chemical that goes all over our body to decrease our blood pressure and make our veins and arteries bigger, veins respond to those stimuli. If you massage your arm, you're going to increase nitric oxide. If you put on a blood pressure cuff on your arm, you're going to increase nitric oxide. Anything you can do, if you do weights, if you do exercise, you're going to increase nitric oxide. The most important chemical in your arm circulation to give you benefits of healthcare is nitric oxide. And stimulation of your arm, exercise, massage, rubber bands, squeezy balls, anything you can find can increase nitric oxide. So if you had to leave the presentation today, just say, you know what, I heard this surgeon, he was talking about arm circulation, and the only thing that matters is nitric oxide. You've met your accomplishment. So let's talk about some chemical and issues that happen for care. Many patients need chemotherapy. Cancer is very common in the world. It's a very serious medical condition. How many of you all have had to go to your medical office, doctor's office, oncologist's office, and have needed chemotherapy? What if you don't have a good vein? What happens? Can you get chemotherapy? What if your veins are not good? What if you have chemotherapy veins where all the veins have been clotted off or stenosed? You must have large veins and you must have a lot of veins. You must find them easily, and they must be a good number of quality veins. If you believe in insanity, sitting at home, doing nothing to increase your arm veins or your circulation, you will not get large veins and you will not get increased quality circulation. Increased circulation definitely means arteries and veins are getting better flow. And that's what circulation is. You want to help your arteries and your veins get better flow. That is so important in chemotherapy. Now, another term that comes up quite a bit for circulation discussions is DVT. A DVT is a deep venous thrombosis. This is not a clot on your skin. This is a blood clot in your vein in the deep part of your arm, the brachial vein, the basilic vein. When you hear those two words, the two B words, brachial and basilic, those are DVTs. They may require you to be on blood thinners. They can be limiting in terms of pain. They can come from having an IV placed, trauma, or maybe your body has a hypercoagulable state. Maybe you're taking estrogen, testosterone, you're at a higher risk. Maybe you have a family history of making blood clots. Maybe you had a blood clot in your leg and now it's in the arm. This is not involving superficial veins. This is the deep vein. And the deep vein can also be treated with ways to increase the circulation so that if you increase the circulation and the veins and the arteries are moving blood, less chance of you to get a DVT. Why do people get DVTs on airplanes? Because they're sitting for 8 hours. But the minute they start walking on the airplane or when the captain or the pilot allows, you're not going to get a DVT. The same with your arms. Many patients ask me about the difference between DVT and superficial phlebitis, or just called phlebitis. Phlebitis means you have basically a clot on your skin in the superficial vein. Not dangerous, usually caused by IV placement, usually treated with Motrin and warm compresses. A lot different than the DVT, which may need blood thinners. Superficial phlebitis is very common after IV placement. How do you avoid it? Get the IV in, get the IV out, massage the veins so that the blood flows. Take an aspirin, take something, apply heat, but make sure you don't get a phlebitis. Usually when you get them, they go away with time, but you have to watch for them. Lymphedema. Now, this is a condition which is really, really important to understand. Lymphedema is a direct arm circulation process. Lymphedema is the clear lymphatic channels in our arms and in our legs, which carry fluid that leaks out of the blood system. So arteries bring blood down, veins bring blood back. We've already kind of understood that. But any blood that leaks out of the arteries or leaks out of the vein goes into the tissue and becomes lymphedema. Lymphedema is swelling. It is very common in those patients who have breast cancer. These patients have had mastectomies. Some of them have had axillary node dissections, which disrupts the lymph flow, and thus the hand swells. The breast cancer patients have another issue. They get breast cancer surgery, they get a lymph node resection, they get lymphedema, and now they can never get blood draw or any procedure on that arm that has swelling because there's a risk of infection. So lymphedema in your arms is a byproduct of circulation issues. How do you treat it? The best way to treat lymphedema is to be educated about it, to wear compression stockings, compression arm sleeves, massage. Massage is very important for lymphedema. And at the end of the day, if you can bring down the swelling, you might be able to use those veins for your circulation benefits. So lymphedema is something we'll talk a little bit later about. Infusion. If you're going to get an IV, a needle placed in your veins, and hopefully just in your veins, not in your arteries, because that's a no-no, the more you can increase your circulation, the more you can make that wonderful infusion technician feel good about the arm circulation you got, the better those needles are going to go in, the better your treatment is going to be. So this is really important for infusion. If you don't have good IVs and you don't have good veins and you're struggling with circulation in your arm and you need to get chemotherapy, and you need to get blood draw. At the end of the day, you may need to get a port, and a port is placed in your chest, right below your collarbone, and it goes into the vein. The problem with ports, it's a procedure. Second problem is, now you got this big vein up in your neck that's got a catheter in it. What if that vein gets a DVT or clots off? What if that scars down? What if the port gets infected? Increasing your arm circulation has the benefit of avoiding ports if you do it well, and you do it early, and you do it frequently. Increase circulation at the right time, at the right place, for the right patient. Arm circulation has been neglected for years in medical care. There's not a single patient that comes to my clinic, even this morning, who does not know the benefits of increasing arm circulation when they need something from me for their arms. I will teach them the importance of that arm circulation. I'm going to now shift gears to a topic that many of you have asked me over the years, and it's a clinical situation that I treat, and I have been treating for the last 35 years of my life and understanding, and that is chronic kidney disease. Everything that we talk about with chronic kidney disease and arm circulation has a ripple down effect to chemotherapy, DVT, lymphedema. Chronic kidney disease care has revolutionized globally. We're not perfect, but we have done a remarkable things with kidney disease globally. It's still a disease that needs innovation. It's still a disease that needs better care, but we all are striving, because what we learn with these chronic kidney disease situation patients, we can apply to so many more situations to help the global healthcare epidemic. And it once again goes with arm circulation. 1 in 10 adults have some form of chronic kidney disease. 40 million Americans today have chronic kidney disease. Many of them go to stage 5. Stage 5 means the kidneys are done. You need some way to get your blood filtered, and the dialysis is the word there. And 4.9 million patients will be on dialysis in the next 3 years. These are heavy numbers, folks. Arm circulation is a big part of chronic kidney disease. How do we give patients dialysis? We do a fistula. We connect an artery and a vein. The vein now carries the blood. The blood comes to the artery and the vein is connected. Now you have a beautiful vein that's going to carry the blood. Here's a patient here basically getting dialysis. We put the needles into this vein. What do you need for a fistula? I have done over 5,000 fistulas in my career. No doubt about it. What do you need? You need an educated patient, you need a good artery, and you better have a good vein. You have a good vein, good quality vein, your fistula will develop and things will go easier. What happens? Patients don't have good veins. They don't have good veins, costs increase, the experience drops, your outcomes are worse. If you have a good vein and you can make that vein stronger and better, your chances for better quality dialysis and better quality veins increases. So what are the options? You can get catheters, you can get a graft, you can get fistulas, you can get various things you can get done to test out those veins. At the end of the day, the most important thing for vascular care, protect your veins, enlarge those veins with exercise, and get the best fistula you can. This patient, if I saw him in my clinic, I'd say, you are ready for a fistula now. Look at your cephalic vein. Look at all the branching. This gentleman was a carpenter. He was using his hand, right hand, every day with a hammer, screwdriver, drill, whatever was the equipment of the day that he needed to use, saws, and look at his veins. He had veins ready for any treatment. Any chronic medical condition he has the circulation to take care of himself. Here's what you need for a fistula for all the patients out there. This is a beautiful fistula on my patient. This patient also did a lot of weights, got a beautiful vein, and said, doctor, can you give me a beautiful fistula? Here is the fistula. Here is the end result. What do you need? You need a good surgeon. You need a good arm vein, preferably 2.5 millimeters or 3.5 millimeters, good artery, and good surgical technique. Once you connect an artery and a vein like this, and that vein gets going, that vein can stretch, that vein can dilate, that vein can have nitric oxide changes. Those things will make that vein and that fistula work. Thus, arm circulation. Here it is again. And of course, many of you have had patients or friends or family and all different types of fistulas. They all work. The key, increase your circulation, do your exercises, do your weights, educate yourself 3 to 4 months before your fistula and say, I want to get my veins better. I want to get my circulation better. Tell your nephrologist, if you think I'm going to need a fistula in a year, let me start exercising my veins now. Let me start preserving my veins now. Let me be ready for that day. Because if I'm ready for it, I'll have the best vein and the best circulation. Fistulas, unfortunately, fail. They clot off. They need ballooning. They take anywhere from 4 to 9 months to be ready. A lot of this is because of late education. Let's all get educated about fistulas, renal failure, arm circulation, like you all are today. You all are the first group in the world to learn about arm circulation from a direct vascular surgeon. And I'm very excited that you're here to learn about this, because this is what is going to make healthcare better when we tackle these problems, which are big, but have hopefully easy solutions. What are some of the solutions? These are what is available in science today. Wear a rubber band. Start a squeezy ball and wear the rubber band, sort of what they call blood flow restriction. You start doing the exercise and the blood flow is being compressed and the veins will get more nitric oxide. Buy one of these from the pet store or when you go next time to the gymnasium and they have these squeezy balls. The more you increase the circulation by doing squeezy balls, the more you put rubber bands and stop your veins from carrying blood out. All these things will help your circulation. And there are many doctors out there who will give their patients these rubber bands and these squeezy balls to use. I think we can do better than this. I think science can make better devices, better ways to help patients. You can do these things, but there's got to be better ways. What does the paper say? Well, the papers say, yes, exercise works. Do you know for the last 15 to 20 years, these papers have been out there telling people, exercise your veins, make those veins bigger, do exercises, squeeze your arm. But patients aren't educated about these things. Patients don't know about these things. Our own clinicians and doctors, nephrologists, oncologists, general practitioners, vascular surgeons, cancer surgeons, they don't know about these things. But it's out there. It's available. You all now will be those ambassadors to talk about these things. I will tell you, you do any of these exercises, the end result will be on your circulation to your hand, to your arm, and that circulation will live in your arteries, your veins, and decrease lymphedema swelling. It's not hard to figure this out. Vein diameter matters. More and more papers. If you're a kidney failure patient out there, God bless you all that you all now have been educated that vein diameter and vein dilation will help you get the best care. These papers are legitimate. Look at the years, 7 years ago, 5 years ago, 2009, 12 years ago, 13 years ago. I mean, this is out there. Very few people talk about these things. At the end of the day, for kidney disease, a paper came out from a very, very successful surgeon, Dr. Mills, who basically said at the end of all of his analysis, the most important factor for successful renal care with a fistula is vein size. If you can hit 3.5 or 2.5 in your veins, your chances of a successful fistula have skyrocketed. I know that 90% of my patients get a fistula because they're educated about their veins. The rest of the world is probably getting 50% fistulas. We can do better. We deserve to do better. We need to do better. And it's a mandate that we do better because the quality of our lives and our quality of our care and our costs and our patient experience and our hope is minimal if we don't do well. Basically, more data showing exercise, hand grip exercises. Just take one of those exercisers that for your wrist and just exercise it. Get a squeezy ball, squeeze your iPhone. Do something with your hands to get more flow to your hands and to your arm. So we talked a little bit about this already, and we're going to get now into the end of the talk. We're making great pace, and we're going to give us great time for questions. Please use the chat box to ask questions, and I'll do my best to answer them. But it's really important that you exercise. Exercise your arm. We talked about the squeezy ball. We talked about, here's a very nice lady doing weights. You can do the hammer curls. You can do biceps curls. Become a construction worker. Pick up horseback riding. Some of the best veins are on patients who do horseback riding because they're always moving their arms. They're increasing the circulation. This patient here has the most dominant size veins you're going to have on the arm. This gentleman, any chronic condition that comes to his care, he would just roll up his sleeve and say, hit me, because he's got veins ready, blood draw. When he goes for his blood draw or his chemotherapy, everybody takes a deep, deep sigh and knows that he's going to get great care. The river of life goes through your arm circulation. You can do a paperclip exercise. You can do weights. You can do anything you want to increase your arm circulation. And if you're a chronic medical disease patient, remember, when you go to the hospital, show us your arm, show us your identification, show us your insurance card, and roll up your sleeve so we can place your IV. That's arm circulation. Number 3 on the list when you go to a hospital. It is very clear that compression has been used historically in medicine for the last 70 years. Whether it's a compression sleeve, you'll see our NBA basketball players about 7 to 8 years ago start using compression on their shooting arm. They want to decrease the swelling. They want to increase the circulation. Increase circulation, maybe they can play 4 quarters and have a better scoring average or more assists or a triple-double. But compression devices work. If you have lymphedema, we know these compression devices on your arm squeeze the fluid out, increase the circulation. This compression device, you can buy them online, you can get them prescribed to you. They help decrease swelling, which helps increase your circulation. You exercise with these compression devices on, your blood flow will be better. You'll get more quality inflow, nitric oxide changes. All that will happen the more you exercise with compression on. No doubt about it, we have learned when you go to the gym and you put on a compression band, you don't have to do the high intensity workout that you may, many of us don't like to be in the gym for more than 30 minutes. But some people are there for 7 to 8 hours because they want that high intensity. You put on a compression band, you do weights, you're increasing the lactate in your muscle. You're basically telling the veins, you're not bringing the blood back. Keep this lactate in my arm. Let my muscle grow. And when I take off the band, nitric oxide will dilate everything. Very simple. Put on a compression band. You can buy, these are called arm slimmers. They just compress a little bit. This gentleman is really working out his veins, and he's basically increasing lactate, increasing his muscles, and then he's going to take down the band and all the nitric oxide is going to wash away. Great way to increase your circulation. But probably the most important thing that I'm a believer in, get out there and have your family, your loved ones, do it to yourself, massage. There is no doubt about it. Focal, general, thumb massage increases the circulation in your tissue, in your arteries, and your veins. You don't have to go to the gym. Just turn on the television, relax, get your friend, your neighbor, your loved one, your child, your daughter, anybody to start compressing your tissue and say to them, I want increased nitric oxide, I want more blood flow, and I want my veins to carry that. So increase my circulation by massage. It is not going to cost you anything more than 20 minutes a day massaging your arm and increasing your circulation. I really mean that. Not a single patient leaves my clinic without instructions on arm massage. So we're going to wind down here, and we're going to talk about arm exercises help circulation. Why is that important? Well, what are the other things? To increase your circulation, get out there and be active. Increase your cardiovascular exercise of your arms, your legs, your body, everything you can. The more you move it, the better you're going to increase your circulation. Circulation lives in our blood, in our vessels, in our arteries, and in our veins. If you smoke, you cannot help your circulation if you smoke. Why? Because nicotine compresses arteries. If you compress your arteries, they can't carry blood. If they're not carrying blood, the veins don't get the blood. Smoking decreases your circulation success rate. Black or green tea is interesting. Some of our heavy tea drinking countries, Asia, in the Pacific, Thailand, Malaysia, a lot of tea being drank there. They have very good circulation in their arms. And the reason is because antioxidants. They basically increase the antioxidants in their body, and that helps keep the circulation going. So green tea, black, drink it. It'll help some antioxidants. Take iron supplements, because if you have more iron, you have more blood cells. More blood cells live in your arteries and your veins. It's not hard to figure out. More blood, more circulation. Brush your body. Do the massage. Take a compression roll. Start massaging those arms. Any of you who have chronic conditions, massage your arms. Please, it's important to increase that circulation. Stress. We live in a world, stress is out there, economic stress, family stress, financial, job, marital, whatever it is, try to minimize that. Yoga, meditation. Yoga and meditation probably increases your circulation just as much as massage. So do it. More omega-3 fatty acids, they help also with vasodilation and compression. We've talked about that. And if I look at this list, it's interesting that all of these 90% of the world can do today. At least 3 or 4 of these, you can do those. Right today at the end of this lecture, you can do 3 or 4 of these. And you'll be saying, wow, I just increased my circulation. You can do it. So I appreciate this opportunity. I hope this talk gave you some thoughts, showed you where I think healthcare is going. We need to do more creative healthcare for our patients. Social media, whether it's Facebook, TikTok, Instagram, there's a lot of education happening. And a lot of it is being driven by the network of friends and family that I know that believe in this whole concept of arm circulation. Hashtag arm wellness, hashtag arm circulation. If you really want to get excited about this and you really feel that there's an opportunity that you believe in this, you can join our science. You know, there's a investment portfolio that is being created that you can learn about these things. You can invest in this research. We can make this a commercial thing. It's not a part of the discussion today. Today was all about the education, but I've seen this now for the last 30 years. There are some major opportunities to help chronic medical conditions with simple, non-surgical, non-medical based physical techniques to increase your circulation in your arm. Increasing the circulation in your arm, there's many things you can eat, many things you can do, but the most important thing is to believe that any type of increased arm circulation will help your chronic medical condition. These are my emails. Reach out to me. Feel free to ask me questions. Feel free to talk to your doctor about these topics. Feel free to take under your own control your arm circulation. So with that, I finished the talk. I wanted 35 minutes. It ended up being 34. Khalil, I hope that was clear. I hope that was educational to our audience. And I've got a good 20 minutes here for any question. No question is silly, stupid, or I've not heard it before. I've been doing this a long time to talk about anything you all want.
Definitely. Thank you, Doc, for the for this awesome webinar. I personally use those BFR bands when I work out. I think they're great. They've helped with, you know, blood flow and just see my veins pop at the end of the workout. It's just, you know, it's an amazing feeling to have.
And now you know, what's the cause of it, as far as lactate filling up, and you're doing the weight, and your veins are not able to get that lactic acid out. Your muscles are getting big, and then you undo that band, and nitric oxide just goes all over. And I bet you your blood pressure will drop after you release that much nitric oxide.
Yeah. And yeah, you're right. You don't have to go insanely heavy with the weights. I use like a 12-pound dumbbell and just, nice and slow. And, it works.
Excellent.
Awesome. Yeah. And as Dr. Said, this is your opportunity to ask any questions you want. So anyone in the audience today who has a question, feel free to ask it. We have, a little less than 30 minutes left in this webinar. So if you have a question right now is the time to do so. Doc, is there anything you wanted to add, while we're here right now?
No, I think that, the whole concept is something very novel, and the whole concept is something that's been neglected. I think people historically have thought they got a condition, they got to take care of it, but there's a way to anticipate to improve your access and better chronic medical care. Chemotherapy, dialysis, blood clots, lymphedema are all related to your arm and need your arm. And if you can improve the circulation in your arm going into those medical conditions, you have a much better chance for better care.
So we have a question here from Seth. What is the total addressable market looking like?
The total addressable market for arm circulation benefits?
Yes.
If that's the question, I don't think it can be calculated. I do not think that market can be calculated. I will tell you, when you talk about chronic diseases that I'm talking about, cancer, renal failure, blood clots, and lymphedema, I just can't even imagine how many millions of Americans, yet globally, need those things. Dialysis, we saw some of the numbers about the millions of Americans that are with chronic disease that could benefit from arm circulation, and then 100 million patients in America at some level needing some type of chronic kidney disease. Cancer numbers are huge and continue to grow. Blood clots, the more we do treatments to the arms, put catheters, blood draw, patients are hypercoagulable. I mean, these numbers are astronomical. And, it's one of the things I have a big interest in, is making those numbers help patients educate and improve their care. But the numbers are huge, huge.
And who are some of your competitors, and what sets you apart from those competitors?
Well, once again, this is now going into sort of the commercial part of our company. We are doing the research on this, and I would love to answer that question, which basically saying, when you have someone with my expertise as a vascular surgeon who's lived in this space and talks about this space and educates this space, we are truly, with our research and our science, at the front running of this science. Today was all about patient care and realizing that we have a problem. But I will say this, and that as you learn about our company, and if you learn about our research, and you learn about all the things we're doing for patients, there's a great opportunity here, and we are really ahead of the game, really ahead of the game. And that might be a very proud statement to say, but I think we're ahead of the game, so patients are ahead of their chronic medical care. But I think as far as squeezy balls and rubber bands and compression devices, you can buy those on Amazon. And so that's great competition. And if the squeezy ball gets you better blood flow and gets you better dialysis, and if your loved ones want to do massage, I believe in all of those things. And I want those things happening. But the business aspect of this, potentially to help patients with easier devices, is exciting and in the future frontier.
And you mentioned, people are lacking the education. Why do you think, it's lacking the education?
I think it's a problem with our medical systems. I think the medical system and the medical care, and maybe patients will chime in, we are historically in America, and I'm speaking to the Americans, a fee for service. We do a procedure, physicians, doctors get paid. We are not proactive. Now we are becoming proactive because the costs are mandating us to be proactive. But I think doctors are not incentivized to say, you may need this treatment in 5 years or 5 months or 3 months or 2 months. Let's start conditioning you for that. They may think, well, that's someone else's responsibility. It's not mine. But as healthcare goes into the home, patients need to be educated. You as a patient on this webinar can be educated about arm circulation. And if anybody tells you you're going to need a procedure on your arm, a simple question, do you think increasing my circulation in my arm will help? There's not a single surgeon who I know that won't agree with that statement. We need to be proactive. We need to be in our home environment. We need to take care of our family members. We need to educate our loved ones. We need to educate our seniors. We need to educate our grandparents, our parents, that there's going to be healthcare issues coming, and there's a way to increase the circulation so that we don't have the discomfort and chronic debilitating issues with access to our vessels, access to our circulation.
So we have a question here from an anonymous attendee. I recently began working out, and my friend introduced me to nitric oxide supplements. What is your take on those type of supplements, and are they effective?
So once again, the big theme in all of this is the benefits of nitric oxide. Nitric oxide is produced from L-arginine. You can buy L-arginine supplements, which increase the nitric oxide. They will increase nitric oxide in your body. I will tell you that exponentially exercise and changing the blood flow in your arteries and your veins will increase nitric oxide 20x, 30x more than a tablet going into your stomach. You want to release nitric oxide in your body? Best thing to do, massage your arm, massage your leg, walk, cardiovascular. Anytime you massage vessels on your arms or your legs, nitric oxide is being released much faster than putting it in your stomach. It works, it'll help, but definitely the better question is if I eat nitric oxide supplements, arginine supplements, and then I exercise, will I increase more nitric oxide? I think the answer to that is yes. But you know, eating arginine tablets and watching a baseball game isn't going to help as much as going to the gym and working out and eating those probably.
Yeah. Awesome. Like we mentioned, you know, this webinar is educational, and if you want to know more about blood flow and nitric oxide and everything that we talked about today, you know, please ask your questions. We still have some time. And you know, we don't want to talk about the commercial aspect of it, as the doctor said. You know, this is more of the educational piece. So, you know, we are getting questions, Doc, about the investment opportunity. Did you want to take some time to talk about that?
So once again, you know, I really wanted, you know, I live literally two worlds. I live a world of a doctor. I have a busy practice, patients who I love taking care of, and patients who've educated me and given me the opportunity to help them. And it's the highest calling in life to be able to help these patients like yourselves who are on the webinar. And it's really my joy. At the same time, as a physician entrepreneur, I've realized that there's opportunities to help more patients with maybe medical devices and advancing medical science. And so one of the devices and one of the companies that I've started that is initially started as a research interest, which is now getting ready to become a device that is soon to be on market, commercialized. It's basically the opportunity to make and sell a wearable, something you can wear below your elbow, below your shoulder, below your elbow, anywhere, which massages and increases the circulation on your arm with battery-operated pneumatic, a simple pneumatic balloon. And that's a unique device. That's a device that was created after 30 years of studying what a device like that could do. And so I'm conflicted in the sense that I really want to see patients benefit with arm circulation. And I also want them to do exercise. I want them to do weights, but I also want them, for those that can't do those things, to have the opportunity. You know, a 75, 80-year-old patient who now has been diagnosed with cancer and now needs chemotherapy, it's going to be hard for that lady or that patient. And I've seen these at the hospital in my own practice and in my own family members, to give them something that will increase the arm circulation so that the final push for their health, they have something beneficial. So the investment opportunity is a website, investvistassist.com. I think our next webinar, those of you who have enjoyed this webinar can learn more about the commercialization of our device. That'll be the next webinar as we talk more about it. But the foundation of arm circulation truly is important and will give everybody, hopefully, a kickstart to their healthcare.
Awesome. You know, if we don't have any questions left, you know, Doc, if you can give one, you know, takeaway from this webinar, what could you, you know, give the audience today?
Wow, one takeaway, a couple takeaways. I think remember that healthcare is changing. Remember that you need to be proactive. Remember that some of the simplest things we've tested in science are still hiding under books and journals that people don't talk about. And if we want to live the world of what goes around and it'll change and comes back in fashion, I really believe simple techniques, exercise, massage, to a focal part of the body which has been neglected, which is the arm blood vessel circulation, is super exciting for the millions of people in the world that could benefit from that education and from those kind of new innovations. And in a non-commercial way of saying this, innovation in arm circulation is here to stay. It's here to launch. You're welcome to be a patient. You're welcome to be an advocate. You're welcome to be an ambassador. You're welcome to take care of yourself. All those things are out there for you. And I'm just excited that you're willing to learn and to be open about those things. We're not asking you to eat anything. We're not asking you to do anything illegal more than take care of your arm circulation.
Awesome. And how can we reach out if we want to learn more about blood circulation?
So I'm very active on social media because I believe it's a hot topic. The hashtags arm wellness, arm circulation, very active on TikTok, very active on Facebook, on Instagram. My email is open to you. I'll do my best to answer as many questions as I can. You can follow me on TikTok. You can follow me on social media. And yeah, learn about us. Look for the next webinar. Make sure you tell Khalil and our Digital Niche Agency that you want to be on the next webinar. We're going to talk more about devices, new innovations, ways that you can invest if you believe that there's an opportunity here to have a say in this science. Maybe you're a healthcare professional, maybe you're a chronic medical disease patient, and you want to have a say in these things. I'm readily available. You can track me down if you're in California. Come up and visit us. And if you're in Las Vegas, where our research hub is, visit us there too.
Awesome. And for whoever couldn't attend today's webinar, this webinar has been recording. And so we will be posting a recap video around the webinar, and you know, where you can use it for your own educational purposes and learn more about you know, what we're doing here today. So thank you everyone who attended today's webinar. Thank you, Dr. Singh, for the webinar today. And yeah, is there any, you know, final things you want to state before we head out?
Stay safe.
Have a good one, everyone. Bye-bye.
Bye-bye.